Greetings from AVP Research Foundation. Hope you all are staying safe at home. We bring to you the second series of AyuLEARN on COVID-19. And let me quickly introduce the panelists here. We have Dr. Somit, Director to AVP Research Foundation. Next, Dr. Aramya joins us, who is the Consultant AVP Group. We have Dr. Prem Shankar, who is the Research Officer at AVP Research Foundation, and we have Dr. Arun, who is the Research Associate of AVP Research Foundation, and myself, Dr. Chaitanya, uh, Research Associate. So today, before starting the session, let us quickly see where do we stand in the statistics as of WHO. So the world confirmed cases of COVID-19 has raised to 2.3 million and deaths has surged to 1.6 lakhs. And coming to India, it has come to 15,723 and the death has come to 521. So definitely the numbers has raised compared to the data day before yesterday. So on this note, we are starting the series, which is preventing COVID-19, the best that we can do. So coming to Dr. Arun first. Dr. Arun, which are all the possible preventive measures that we can take to prevent the COVID-19 from attacking us? So coming to you, Dr. Arun, what is your take on it?
Yeah. No, then as you said, the number is increasing in very high speed, and so we know that prevention is the best thing what we can do at this point. And the general preventive measures, as per the Indian Clinical Research Foundation as well as World Health Organization, as all we know that prevention is the best method we can do here at this point, because the number is increasing in a very fast manner. The main possible prevention, there are almost 5 points which we definitely have to follow. And the first thing is wash your hands frequently. The regularly and thoroughly cleaning your hands, alcohol-based sanitizer or soap. It's because washing your hands with soap or using alcohol-based hand sanitizers that directly kills the viruses which may be present in your hands. And the next main thing is maintaining social distance. Of course, you know that lockdown and other things are applied for the same purpose. And social distancing, at least 1 meter, that is 3 feet distance between yourself and anyone who is coughing or sneezing. Because when someone coughs or sneezes, they spray very small liquid droplets from their nose or mouth, which may contain viruses. If you are too close, you can breathe that droplets, and which may include some COVID-19 viruses also. So, for preventing that kind of spread, we have to follow or maintain a social distancing. And next thing is avoid touching eyes, nose, and mouth. It is because when your hands are already having some viruses, or when you touch on a surface which is already having viruses, and your hand can get contaminated. And the same hand, if you touch in your eyes, nose, or mouth, from there it can spread to your body and it can make you sick. So it's strictly we have to follow, avoid touching eyes, nose, and mouth. And the third point is practicing respiratory hygiene. This is mainly because the virus is spread mainly through the droplet inspection. It's mainly due to the droplet infection. And by following good respiratory hygiene, you protect people around you also. Not only just you can protect the whole community itself. And the other main point what we have to look into is, like, if you have any fever, cough, or difficulty in breathing, immediately you have to seek medical attention, and immediately you have to contact with the local or national health authorities. And before getting infected with this one, we have to maintain a hygiene, and as well as we have to, once you get infected or you feel that your surrounding is getting, that some people around you is getting infected, so at that point you have to go for quarantine, self quarantine or home quarantine. That is the best way we can prevent the spread of this virus and getting sick with this virus.
Thank you, Dr. Arun. So in Ayurveda, we have a lot of domains wherein the preventive measures has been explained very detailedly and beautifully. Be it dinacharya or be it a patyam for the disease-wise patya, or is it on a general patyam, or we have a lot of domains wherein the preventive measures is elaborately explained. So may I take this question to Dr. Prem Shankar? Which are all the possible domains which we can relate to and consider in preventing this COVID-19 epidemic to stop from spreading to others? So what are all the preventive measures from Ayurvedic perspective that we can take?
Good morning, everyone. So today I'm going to discuss some of the topic from our Ayurvedic classical texts regarding the prevention as well as how to maintain a proper health for the general public as well as for the health workers and the doctors and who are treating the communicable diseases. So according to WHO, the state of complete physical, mental, and social well-being is considered as the health. And according when we comes towards the Ayurveda, it states that samadosha samadadu samagnischa malakriya prasanna atma indriya manaha. So here we can see the physical well-being as well as the psychological well-being has been explained in Ayurveda very well. So how to maintain all this? We'll just go through very few points just to refresh ourselves when those who are staying at home as well as those who are working in the health sectors. So according to Ayurveda, there are some topics just like our daily routines, otherwise the dinacharya and the ridhucharya or the seasonal routines which is applicable at this condition, and the importance of personal hygiene and the role of social distancing in the present condition. And the Ayurveda, it is mentioned that the suppression of natural urges goes to specific conditions or diseases and how to avoid all that. And also the importance of our diet, our sleep, and our celibacy. These are the main three pillars which is helping our health, or it is maintain our proper health. So when we comes towards the dinacharya or the daily routine in Ayurvedic classical, it is explained that the person has to wake up in the Brahma Muhurta or in the early morning or before the sunrise. So here in a practical aspects, what we can do is there may be some exceptions, just like old age people or those who are affected with certain illness or those who are very low immunity or those who are very less in their other general health related their abilities. So according to the power of their immunity, we can decide the what time they have to wake up. So it can be advised by a physician, and those who are healthy, they have to wake up early, and immediately after waking up they have to eliminate their natural urges. Here what we have to be careful that the natural urges has to be eliminated when there is an proper urge. It should not be done by any forceful, like we should not eliminate the like urges forcefully. So it can lead to certain other disease conditions which is already explained in Ayurveda. And after the elimination of natural urges, the person has to undergo the dandadavanam or brushing. So in Ayurveda, there are three tastes they have preferred here. They are Kashaya, Kadu, and Tikta Rasa to be used for the brushing. Why? Because these are the three tastes which can eliminate the kapha dosha or any kind of deposits in our oral cavity. So that can be clear, or it is understood clearly that it is meant for avoid of any kind of infection from the oral cavity. So immediately after the brushing, the person has to undergo the Jishva Nirlaganam or the cleaning his tongue to eliminate the deposits or the kapha dosha, which can lead to any kind of infections. And after that, the next step goes to the anjanam or application of collyrium. So in Ayurveda, in Ashtanga Sangraha and in Ashtanga Hridaya, in Dinacharya, it is clearly mentioned that the person has to daily apply a particular anjanam called like Savvira anjanam. So it is mild in potency as well as it is helping to protect vision as well as the eye. And another one kind of anjanam which is called as rasanjanam. Rasanjanam is prepared out of Savviranjanam by doing the trituration with the kashaya or the decoction of Berberis aristata. So it has to be, and when we come towards the Ritucharya, we have to be clear that Ritucharya in the present condition in South India or in India, it is considered as the summer. Summer is the hottest season. So the sun is powerful. So the person has to undergo certain food which is easy to digest and the taste which is madura and can be applicable here, and more intake of ghee and easily digestible light food has to be taken internally, and the dress which is thin and light dress has to be worn during this season. And the personal hygiene, it is clearly mentioned in Samhita that asamvrdaha mugaha shavadu udgara vijrumbanam na kuryat. That means one person should not laugh, sneeze, or belch or yawn without covering his face. It is already mentioned in our classics. So the importance of wearing mask already explained here. And nasigayam na vigushniya. He has explained that the person should not scratch or touch his nasal cavity with his bare hands. So it is clearly mentioned that how the infection spreads. And pani dvayena atmana sirasahana kanduyet. That the person should not scratch his scalp or hair with his bare hands because it can lead to any fungal infections to the other parts of the body. And the communicable disease, the concept of communicable disease also mentioned in our classics that prasangat gatra samsparshat sahabhojadan sahashayasinat chabi vastra वस्त्रमाल्य अनुलोभनात् कुष्ठज्वरश्च शोषश्च नेत्र अभिष्यन्दश्च एव च औपसर्गिकश्च संक्रमन्ति नरान्. Here it is explained that the concept of communicable disease along with the mode of spread explained by the Susruta, the spread from person to person by contact with the touch, respiration, sharing the food, sharing the bird seed, using the cloths used by the person suffering from any communicable disease. So the social distancing has to be followed, clearly mentioned in our classics. So this is the general preventive care which has to be careful regarding our daily routine and our seasonal routine. And when we comes towards the ahara, we have to be very careful regarding our digestive fire. Digestive fire in the sense the person has to undergo only the light food which is easily digestible, and it can be variable, depends upon the region and the age and the capacity of the digestive fire, and if the person is suffering from any particular diseases, according to the diet should be followed. So these are the very basic things which has to be followed, and the person has to be careful regarding the nidra or the sleep, because the sleep provides the happiness and the nourishment, emaciation, strength, debility, sexual power, importance, knowledge, everything is depends upon the sleep. So the person has to undergo an average of 6 hours sleep, and it should be continuous. So these are the general things to be followed, or general things which are explained in our classics. There are a lot, but still the time permits, so I am just explaining only the very vital point which has to be done by the general public as well as the health.
Okay, Dr. Premshima, can you just conclude and enumerate only the points, that take home points, which are all the things like you said waking up in early morning at Brahma Muhurta, so then it comes to Dinacharya. So can you just enumerate all these points and just give it us in like the capsule form?
So during the Ridhucharya, the person has to wake up in the early morning, and after that the person has to undergo other like step by step process in their daily routine, the elimination of natural urges and the brushing and the cleaning of the tongue, and the application of collyrium or the anjanam, and thereafter the patient has to undergo the nasal instillation of medicated oil, which can help uh, cleaning the airways on or to avoid any infections towards the airways. And the gandusham or the gargling process has to be done with the medicated decoctions or the salt water, which can be also helpful in oral hygiene as well as the cleaning the throat, or the any infection through the throat can be avoided. And also the nasal instillation of medicated smoke also can be done. Here the process is that the medicated smoke has to be instilled through the nasal cavity and it should be exhaled through the mouth. So upper respiratory tract will be cleansed and disinfectant action also will be there. And the abhyanga or the oil application has to be done in the morning, and after that the patient has to undergo vyayama or exercise, and after some time the patient has to undergo the bath. And while bathing the person has to be careful that the body has to be done washing with the lukewarm water, at the same time the head with the plain water or the cold water, because the hot water gives strength towards the body, and the plain water gives strength towards the hair, ear and nasal cavities, and our eye and all the other sensory organs. So these are the daily routine which has to be followed by the individual. And the Ridhucharya, there are seasonal changes will be there in each region. So accordingly, we have to select what is applicable for which nation or which region. So here it is summer, so we have to follow the regime which is explained in the summer region and summer season in our classics.
Thank you, Dr. Prem Shankar. So, if I have to conclude, would it be like know yourself, know your body, and plan your day in the most healthy way it has to be? In the routine, waking up early morning, having the abhyangam daily, and taking food which is good for the body according to the digestive power, and having a seasonal regime, keeping in mind in which desha you belong to and the climatic condition which prevails. So I think this
And
can it be the conclusion of
yeah,
the things that you have
yeah,
told?
and also give the proper like the importance like the personal hygiene as well as the social distancing.
Yes.
It is also mentioned.
Yes.
Yeah.
Thank you, Dr. Prem Shankar.